Good morning. My name is Rebecca Cook and I'm with Bella Pilates. I wanted to go over with you today what you can do when you start having back pain when you lie down in bed. And there are some things you can do for mobility and also different ways and positions that you can put yourself in when you do go to sleep. So I wanted to start out with a few exercises or movements that will help alleviate back pain. The first one, you're going to sit down on the edge of your bed and the feet need to be flat on the floor. And what you're going to do is you're going to take your two fists next to you. I have short arms, so it might be close to your body or it might be a little further away, but you're actually going to push up and try to elongate, lifting your sternum, getting the best posture you can, really lifting your spine up. So you can really see that I could be slumped down after the day and I can really stretch my spine and lengthen. So we want to hold that for about 10 to 30 seconds while pulling in our transverse abdominis, that innermost layer of abdominal muscle. And you do that by just feeling like you're corseting in the waist. You kind of pull navel to spine, pull your sides in, pull your back in, and you're kind of contracting those deep abdominals. So again, you can relax, and then you can go back into that stretch. Some of the things you can think about as you're stretching up and breathing through that movement is that you are separating, making space in between each vertebra of the spine, as if light could pour through your spaces in between each vertebra. Or maybe you want to think of a balloon attached to the crown of your head and it just slowly floats you up, hovers you above the hips. So we are creating space in that lower lumbar in particular because we know over time during the day we become a little bit more compressed with gravity. Okay, so the next thing I want to go over is what's called a pelvic tilt. Now we'll go over doing it sitting down, but I want to stand up first so you can see my pelvis. So right now I'm in sort of a neutral spine. Some of us have a little bit more anterior pelvic tilt. Some of us have a little bit more posterior pelvic tilt. And what I want you to do is put your hands on your hips. We're going to inhale, deep breath, as we tip our hips forward. So it's like a bucket of water, we're pouring the water out the front. And then on the exhale, we're going to tip our bucket of water back so that our lower lumbar is tilting backwards. And then we inhale and exhale. And we're just getting a little bit of mobility here. You might have to bend your knees slightly, and you can do this very slowly. You can also do it seated, although you won't be able to see the tilt as much from this camera angle. We can inhale, tilt it forward, exhale, tilt it back. Inhale, tilt it forward. Here's where you activate the abdominals. Exhale, tilt it back. And you can just let your sits bones, those little bony prominences underneath your tush, kind of rock back and forth. So we're just rocking back and forth and we're getting some mobility. Now, if you're moving into that posterior pelvic tilt or that anterior pelvic tilt and you feel any sort of pain, don't move into the pain, just go right shy of it. So you're just going within a range of motion that feels good to your body, getting some movement there. If you're still feeling pain even with that movement, try to just discontinue it and you might need to see a doctor or a physical therapist, okay? So the next thing I'm gonna show you is what that pelvic tilt looks like when we're lying down on our backs. So I have my shoes and jeans on. I have somewhere to go today, but we put a mat here on the Cadillac. I'm gonna put my hands on my pelvis and now I can inhale, tilt, think of a bowl of water sitting here. I'm gonna tilt my pelvis this way on the inhale, making a little mouse house underneath my low back. And then I'm going to exhale, tilt the bowl of water towards my head and that's gonna flatten my low back into the mat. So again, I inhale forward and I exhale back. Now you wanna try to, on the exhale, not do that with your hip flexors or your glutes squeezing. Try to think of pulling your navel in towards your spine so that it's coming from the abdominals. Inhale, tilt. Exhale to curl back this way. And it's a great way to mobilize that lower lumbar. You'll feel your whole spine kind of shift back and forth like a wave on your bed, okay? So just a really nice mobility exercise. Now let's get to the positioning that we want to be in when we're side lying. Our pelvis can go back and forth just like we did, forward and back, okay? It can swivel side to side, okay? There we go. Or it can up slip and down slip. And that's what I want to talk about when we're going into side lying. When you're side lying, we're going to take on my right side today, but you could be on either side. When I'm side lying on my right side, what naturally happens is that my left hip is going to be coming up towards my left rib cage, and therefore my spine is kind of curved at this angle, okay? So it's making this curvature. What happens is sometimes nerves can be impinged a little bit until you relax. You can have other issues like a bulging disc. So again, if this is not something that helps relieve that back pain, I suggest that you do go address it with some sort of practitioner that you feel comfortable with. It could be your doctor, but I would really suggest a physical therapist, a Pilates practitioner, or a chiropractor. Even an acupuncturist or massage therapist may help you get into better alignment. So we're gonna lie down on our right side and we're gonna take a pillow. This one is very thin, but you can have something more fluffy. It just depends on how much you wanna separate your legs. So we're gonna side lie on our side, and we're gonna put this pillow in between our knees. And so what happens when we do that is it helps create some space in the hips. It actually helps elongate this hip a little bit towards our feet. We can also bend the knees a little bit. That may help as well. But this is a really nice tool. It's very easy to use lying in that side lying position. So we really do want our hip bones, those bony prominences at the front of your hips, to be kind of in a straight line. They want to be stacked up and down. Those are called your ASIS joints or your ASIS joints, okay? So we want those stacked as if there's a stake just going straight through. We don't want it to be like this where you have this diagonal line, okay? So the other thing that you can do in addition to that, if that is not helping, is you can take, I would suggest a thinner pillow like this because it's not going to be, you don't want to have this big bulky pillow moving you in a pelvic tilt the other direction. So you don't need a huge pillow. It could be a couch pillow, just an accent pillow that's a little thinner than your normal one. Excuse me. And you're going to side lie on top of that. So again, what happens is that helps bring this left hip down because it was wanting to up slip. So you can have this pillow underneath your right side waist if you're laying on your right side, or your left side waist if you're laying on the opposite side. You can additionally still put that pillow in between your legs, and that just puts your whole spine into a little bit better alignment so that you're not lying down and having that hip up slip. I'll show you one more time what it looks like without either one. And you can see my left hip now is kind of lifted up towards my left rib cage, and over time that can really set our hips out of alignment. Okay, so I hope those couple of things will help bring you some relief as you go to bed at night, and just another tool for your toolbox. Again, I'm Rebecca Cook with Bella Pilates.